Hello and welcome to Health Watch. I'm Bob Stillman and I'm here with a panel of experts from Hazel Crest's very own Advocate South Suburban Hospital. Our topic today is breast cancer. Now, breast cancer is the second leading cause of cancer death among women. It's exceeded only by lung cancer. Now, death rates for breast cancer have gone down steadily since 1990. And this is mostly attributed to increased and early screenings, increased awareness, as well as improved treatment methods. Now, I'm so pleased to be here with a couple of experts I'm going to introduce today. Starting with Dr. Tonya Austin, who is a family medicine physician and is on the medical staff at Advocate South Suburban Hospital. Welcome. And Ann Kuvala, who's the clinical nurse specialist for the hospital's Breast Health Center, to talk about detection and treatment options. Now, Dr. Austin, if we could start with you. I understand that most physicians will perform annual breast examinations to their adult female patients. Now, when do you advise your patients to schedule their first baseline mammogram?
The baseline mammography begins at age 40, and usually the interval in between screenings is between 1 and 2 years. And once a woman reaches age 50, at that time, annual mammography screening is recommended. However, all women should be presenting to their primary care physicians or gynecologist for annual gynecological exams such as pap smears. At that time, clinical breast exams are performed on the patients in the office. Typically, when a woman is under age 40, that clinical breast exam can be performed anywhere from every 1 to 3 years. Once a woman reaches age 40, then again that's an annual.
Very good. Okay, and now a question for Ann. Now, as the clinical nurse specialist for the hospital's Breast Health Center, you are out in the community throughout the year and educating women about how to conduct their own self-breast exams. Why are self-breast exams so important, and can you share this technique with our viewers by using your breast models?
Sure. One of the things I really propose to women is that breast cancer awareness is really part of a triad. As they're younger, they can start the breast self-examination, which I'll show you in a minute. They also have to have clinical breast exams and mammography, when the time is right on a yearly basis. Now, women are really self-conscious about doing self-breast exams because women's breasts are very lumpy anyway, and it's just the architecture of the breast. So I'll show you on this, but I'm going to start on myself actually, because women's breast tissue is not just the mound that we see on the breast. It actually includes up into the armpit, and it actually includes in that bone in between the breast and up above the collarbone. So when I teach women how to do breast self-examination, I teach them 3 fingers. We do 3 depths, and I'll show you on here and then I'll show you on myself. We do a light compression in a circular motion, dime size, a little bit deeper, and then deeper yet. You may even feel the ribs if you have, smaller breast tissue. And the reason for that is, as you're compressing the breast tissue, some lumps may move to the side. So you do want to make sure that you're getting into that area. So I always have women start in the armpit, and I do the light, the medium, the deep, and then just 1 finger breath down, light, medium, deep, and I keep going all the way down to where actually your bra ends. And then 1 step over, 1 step over, 1 step over, same thing. Now, it does take a long time. So I don't really advocate doing it in the shower. I'm in the shower. I do it in the shower. I start thinking about what I need to get at Dominic's and, what activities my kids have in the afternoon. So I get a half a breast done, and that's not appropriate. So I do it laying down. I do it in the bedroom. and it's the light, the medium, and the deep. And you're actually covering every area a couple of different times. Now, the first time that you do it, you're going to be freaked out because you're going to feel things that you've never felt before. But I can promise you that if you do it every month, the last day of your period or a couple days after, when your breasts are not as filled with fluid, that you are going to start to feel things that are different. If you notice things that are different, go back to the other side, see if you feel the same thing. If you're not, that's the time that you should start to see your physician.
And can I just interject a little
Please.
bit? I just want to highlight what you said in regards to when to examine the breast.
Yes.
We definitely recommend doing that about 3 to 5 days after a woman finishes her menstrual period. And that's because the breasts are very lumpy bumpy.
Right.
And they do change in texture throughout the month due to our hormonal fluctuations. Mm-hmm. And so a woman could be fooled into thinking something is abnormal because she's checking her breast at varying times throughout the month, when in actuality that may be her normal at that period of time. So you want to be really consistent in terms of when you examine your breast. Furthermore, some women have breast tenderness when it gets close to their menstrual periods. So if you perform the breast exam after the menstrual period, it's more likely to be a more comfortable exam, less painful. And then finally, when I'm demonstrating breast examinations in the office, I too, discuss the 3 depths in terms of palpating the breast. But what I like to encourage women to do is actually to examine their breast more in an up and down fashion as opposed to a circular fashion. Typically, when you get materials that show you how or demonstrate how to examine the breast. Do you mind if I use one of your
Not
models?
at all.
Typically, the information that you receive will encourage you to examine the breast in a circular motion. I usually encourage going up and down, like so. Yes. And that's because you're more likely to cover the entire breast as opposed to, potentially missing some areas. And actually, the longer you're able to do the exam, the better, the more accurate it is. So we do encourage you to take your time. If it takes 5 to 10 minutes, that's fine. That's a better exam than rushing through it.
Right.
Okay. Thank you, Doctor. That's a great point. I had a question here too. Now, if a lump, and Dr. this is for you, if a lump is detected either through the examination or through a mammography, what is the normal next step then?
If a woman palpates a lump herself, or if the doctor actually feels a lump during a clinical breast exam, then that woman is recommended to have some form of imaging such as an ultrasound or a mammogram, which is a special x-ray of the breast. The type of imaging that's most appropriate is dependent upon that patient's age. Usually women who are under 40 years of age, the majority of lumps that are felt by the physician or the patient typically are benign, that is not cancerous, and usually are cysts, which are basically just simple fluid-filled containers. And so for that reason, usually if a woman is under 40, ultrasound is the first imaging modality that's utilized. And that's because ultrasound is actually more sensitive, if you will, than mammograms in being able to pick up benign or cystic lesions. Furthermore, women who are less than 40 years of age typically have very dense or thick breast tissue. And so ultrasound is actually more superior than mammography in terms of being able to really characterize a lump, in terms of